Hello, my name is Charles, and in today's video, we're going to talk about should you take ADHD medication, and in particular, we mean stimulants like Adderall, Vyvanse, all that kind of stuff. So this video is going to cover, some of what it does, some of whether or not you should or shouldn't take it, how it affects people, and both my own life experience, some data, and why a lot of people who have it have such great experiences with it. So first and foremost, right, what does it really do? Well, after doing some research, dopamine and norepinephrine in the brain when you take things like Adderall and Vyvanse are increased. I mean, there is some complex neurochemistry that I am not qualified to perfectly understand, or at least don't perfectly understand myself at this moment, but it does allow for those two neurotransmitters in the right areas to heighten your focus and get things done. Now, if you have ADHD and you're like, should I use stimulants? What are like the pros and the cons? Why do people do it? I think one of the pros is that depending on life condition, so let's say, for example, right, you're a student and you don't have time to do a little statistic that I should bring out, and I will link all the stats and info down below, is that as compared, right, so if we compare stimulant medication in terms of treatment outcomes to therapy for ADHD, after 6 months, they're about equal in terms of efficacy. Like, you're going to do just as well going to therapy after 6 months than you are just taking the stimulant. That being said, if you have a month left and you can't seem to focus for the life of you, and you don't have all the time and money and energy to go to therapy and you're a student, then sometimes just taking the stimulant is more effective for your life situation. So that's where it's important. Now, so depending on life situation, it may be better to use the stimulant. There are a couple things. One is the stimulants can be super effective, and there's tons of studies that show they are effective for treating the ADHD symptoms and for allowing people to focus and get things done. They're obviously performance enhancing. That's why so many, organizations, including, sports organizations, ban them as performance enhancing drugs, because we know they allow you to perform better, focus better, get things done, be more effective. And then so we know they're effective, we know they're useful. So if you do have ADHD, then yeah, maybe you should take it. Maybe it would be helpful, or maybe it would improve your overall life trajectory. And I think there's two things to consider if you are going to do it. One is, just because it works super quickly doesn't mean it's actually the right thing. See, one of the problems, or quote unquote problems, with ADHD meds is they work super duper quickly, which means you're going to associate it in your brain with, this is a great solution. I take a pill, 30 minutes later, look at that, I can focus. Awesome. That feeling of, I take something, 30 minutes later, I'm now able to get all my work done. That's incredible, right? But that tricks your brain into thinking that's more effective than other means, which take a longer time to get there, right? If you're working on something and you get immediate results, you're going to be more inclined to do it than if the results take longer, even if that way is a better system. And so that's something to be cautious of. And then something to appreciate is, if you take them, right? Let's say you are in that student situation where you're like, man, I don't have time for all this therapy, nor do I have the money, but I can take a med and that will help me. That life trajectory of taking a med, let's say for 4 years in college, and then having your whole life trajectory, now you have better socioeconomic status, now you have healthier foods, your whole life trajectory is far better than what it otherwise would have been, may allow you to live such a better life. So even if you don't think it is the optimal choice immediately, long term, that may be the better choice. And so I think it's something to evaluate is, when am I taking this medication? Do I really need this medication? And as always, I am not a medical professional. This is not medical advice. So if you really want, the nitty gritty, you want to get a brain scan or you want to take an ADHD test, go consult your doctor. Go consult not the guy in a Hawaiian shirt on YouTube. Go consult an actual doctor, an actual MD, and he will tell you some of the pros and cons in terms of addiction, dependence, and success, and efficacy, and all that jazz. This is just my 2 cents. I think ADHD meds, if you do have them, are absolutely wonderful and have tremendously beneficial outcomes. But I think it's with the guidance and with the approval of a qualified doctor who is helping you and who is guiding you through the process, or is helping you understand, is this the most effective way to do things, or is this not the most effective way to do things? So consult your local doctor. Have an amazing journey. And if you do have ADHD or if you don't, good luck on your journey. God bless. We all know we need help along the way. So go ask for it if you need it, because it's better to get your help than not. God bless and have a wonderful day.